some women do not attain menstruation even at the age of 15 due to various reasons. So the most important thing is that normally a girl attains menstruation between 9 to 15 years. But if she does not get her periods even by the age of 15 years, then that calls for investigations. So you need to go and take your child to a gynecologist and get herself completely evaluated. If the child does not attain her menstruation by 12 to 13 years, then the gynecologist will thoroughly check the child and see whether all her secondary sexual characteristics are well developed. If it is well developed, then they will do a scan to see whether the uterus is developed. But there are certain instances where the uterus will not be present. So we call that as MRKS syndrome. So in this situation, if you see, not only the uterus, these girls will have developmental problem with the kidney also. They may not have the kidney in the normal position, or there may be some defect in the kidney. So what we generally do is, these girls also will have problem with the vagina. They will not have the birth canal develop. So in such a situation, we have to offer them a vaginoplasty laparoscopically, where we create the vagina by taking the inside lining of the abdomen called the peritoneum and create a vagina which looks like a normal vagina. So as a result, they will have a normal marital relationship. But for them to get pregnant, they can go for uterine transplant, or they can go for surrogacy also, because these girls will have a good ovary. So eggs will be good, but only thing is they do not have a uterus. In such a situation, either they can go for surrogacy or they can go for uterine transplant. But after the baby is born, the uterus has to be removed. So this is one condition. So the another condition where they do not get their periods even at the age of 15 years is that when their hormones are not working well. So in such a situation, we give them the hormones estrogen and progesterone and wait for the withdrawal periods. Most of the time, after stopping the tablets, in 4-5 days time, they will get the periods. So what one needs to understand is that for a normal menstruation, the brain, the ovary and the uterus have to work in a synchronous manner, that is in a normal manner, so that the brain is the band master and it has to give all the signals properly, so that the ovaries will respond properly and the uterus will respond properly and they will get the normal menstrual cycle.